Hi, I'm Daniela Worth. I'm a physical therapist, and today I'm going to talk about what to look for in a PT clinic when you're shopping around. So, first of all, if you find this information helpful, please like this video and subscribe to my channel. So, you got injured, you have a referral from your physician saying, yep, let's try physical therapy. And you look up PT clinics near me, or you ask your insurance, okay, who am I covered through? And you have 20 options come up. First of all, if there's someone who you've heard of, I always say start there. Or if there's someone a friend of yours who had a really good experience somewhere, I say try there. Word of mouth and patient experience is really valuable, so don't underestimate that. Second of all, when you're calling the clinic, I would directly ask them, how long are my appointments and do I have one-on-one time with my therapist? If they say you have one-on-one time for the first visit, after that you might be seen with other people, I would turn around. I wouldn't go to these clinics personally. I was a tech in one of these clinics. So that means that there is the physical therapist and then there is the tech who helps the physical therapist. The physical therapist might say, can you show my patient this one exercise? Can you give this person an ice pack? Can you clean up the table for me? Things like that. But the tech is not supposed to do physical therapy. Only the physical therapist can do that. And a lot of times there are really excellent physical therapists in these clinics. There's not anything that I'm trying to say against these PTs who work there. However, they're really set up to fail the patient. You can't provide your best care if you're caring for 3 people at once. So I would never work in a clinic like that ever. And I would never send a loved one to one of those clinics. I don't feel like they have as good of patient results at all. So 100%. So your first question, how much time do I have with my therapist? Your second question can be, do I need a specialist? So many conditions don't need a specialist. However, if you have a sports related injury, let's say you tear your ACL and you want to get back to sports, you're hoping, usually the clinic staff, the schedulers, are understanding enough that they wouldn't do this, but you don't want to be paired with someone who specializes in, say, pediatrics and almost never treats adult athletes. You want to be paired with someone who is used to sports training. Now, most of the time they will do this. However, if you have, say, a pelvic issue, you want to be with a therapist who really specializes in pelvic health. There are some things for me, for example, that I can identify, hey, I think you would be appropriate for pelvic health, but I cannot treat those and I don't feel comfortable treating them because our pelvic specialist at my clinic is much more qualified to do that, and it's a much better use of the patient's time. So that's what I recommend. Third question to ask, how long are my appointment times? So if you're told the appointments are 30 to 45 minutes and you get one-on-one time with the therapist, I'd say that's pretty good. 30 is a little bit on the lower end, but it's not uncommon. 40 to 45 minutes, that's fantastic. And frankly, you really don't need much more time than that usually. Usually you can get everything done that you need to. And also, man, most of the time you're going to be exercising. So think about working out. It's like a 45-minute workout specific to your injury, which is what you're going to get most of the time. Now, there will also be times where your therapist will do some hands-on treatment, or sometimes it might be all hands-on that day. It depends on what your needs are, but 45 minutes, that's what my clinic does personally. Fantastic. I'd say that's perfect. But again, if there's a clinic that says, hey, you're not guaranteed one-on-one time with your therapist, however, you can take as long as you want for your sessions, some people like that. Personally, I don't recommend it because, well, first of all, I want one-on-one attention from my therapist. I want my therapist to be able to pay attention to me. I will say, as a therapist, it's really difficult to pay attention to 4 different people at the same time, which is the legal limit of the amount of patients that you can have at once. It's pretty much impossible for me to watch and keep track of every single person at the same time. I mean, I could do it, but I'm not going to be doing as good of a job as if I just have one patient in front of me. So a lot of times these clinics will say, oh yeah, you don't get one-on-one time, but you have as much time as you want. I personally don't think that's a very good model. And also, truthfully, when a therapist bills for their time, so I have to legally say, we spent 15 minutes, 10 minutes, 15 minutes, 3 minutes doing massage, we spent 10 minutes doing exercise, we spent another 10 minutes doing balance. If you're there for an hour and a half, I can put in an hour and a half worth of billing. And that works out financially well for that clinic because they get way more reimbursement than a clinic that is only billing. So for 45 minutes, that would be called what we call 3 units, don't worry about it, versus 6 units. They get paid per unit. 6 units would be an hour and a half. 3 is for the one-on-one 45 minute. So if I have 4 patients in front of me and I'm seeing each of them for an hour, let's say hour and a half, because that's what I said. 4 patients in front of me, I'm seeing each of them for an hour and a half. That's 24 units that clinic gets paid for instead of just 3 for the one-on-one care. And so this is not patient-centered care. This is called maximizing the financial benefit that you can take home. And so that's not what I want to drive my care. What I want to drive my care is what's best for the patient. And so that's just something to consider and keep in mind. Again, if you found this information helpful, please like this video and subscribe to my channel. And as always, if you have any questions, please feel free to drop them in the comments and I'll get back to you.